Problems in the lymphatic system can create swelling in the body. If there are concerns regarding limb size, a doctor should be consulted as soon as possible. Dieting or sports does not always help a swollen leg. In some cases, this could be symptoms of a condition such as lymphoedema.
Our
lymph vessel system is the third vascular system in our body. Everybody is familiar with the arteries and veins. We all know about them. But too little is known about the lymphatic system, among laypersons and among doctors too. We know a lot about the lymph nodes and about their function too, but far too little is known about the network of lymph vessels itself. Despite the fact that the lymph vessels are responsible for disposing of all our body's waste, they have the task of transporting all of the water from the spaces between the tissues and disposing of breakdown products of protein metabolism and inflammatory products through the lymph nodes. The lymph nodes act as sieves that filter out these solid substances and in the process also produce proteins for our immune system before returning the fluid to the blood circulation via the venous angles. So what happens if the lymph vessels become defective, and how can they become defective? We distinguish between primary, that is congenital lymphoedema, and secondary or acquired lymphoedema. In the case of congenital lymphoedema, it is possible that either too few lymph vessels are formed right from birth or during lymph vessel formation, or that the lymph vessels do not develop properly, that is, they lack valves. These are the primary forms of lymphoedema and affect around 1.8% of the total population. In the case of secondary lymphoedemas, we differentiate whether the lymphoedema is caused by a malignant process or not. A tumor can, for example, also squash a lymph vessel, so that in some cases, the lymphoedema is seen and recognized before the tumor itself is detected. In other cases, the patient has an operation to remove the tumor and the lymphoedema develops years later. Secondary benign lymphoedema is a disorder of the vessels and lymph nodes that can be caused by infections. This is the most common worldwide cause and brought about here by parasitic nematode worms that are transmitted by mosquitoes and live in the lymph vessels, which they damage. Ultimately, this leads to the final clinical picture known as elephantiasis. Lymph vessels may be damaged by mechanical means, injuries, or surgery. It may be necessary to remove damaged lymph nodes or to remove lymph nodes as part of cancer surgery. Part of that ongoing treatment may be chemotherapy or radiotherapy, which could also cause damage to the lymph nodes. What is edema? Edema is the accumulation of fluid in the tissues that can be seen and is palpable. With lymphoedema, we know that the lymph vessels or lymph nodes have been damaged and the lymph fluid can no longer drain normally, leading to considerable swelling of the affected parts of the body. We divide this into stages depending on the severity. Stage 0 lymphoedema. The lymph vessels are damaged, but there is no visible or palpable swelling. We know that an operation has been performed at which lymph nodes were removed, but the patient does not have any lymphoedema, that is, no swelling that can be seen and is palpable. Stage 1 lymphoedema. The swelling goes down when the limb is elevated. The lymphoedema is spontaneously reversible. That is, it disappears of its own accord overnight by elevating the affected parts of the body. Stage 2 lymphoedema. The swelling is permanent. There is early hardening of the underlying tissue. The lymphoedema no longer disappears when the limb is elevated. Stage 3 lymphoedema. Pronounced lymphoedema with hardening and complications such as wart-like changes and often erysipelas, one of the most common complications of lymphoedema that damages the lymph vessels further. These are the stages that lymphoedema is divided into. Specialists in this field are called phlebologists. Although they concern themselves primarily with venous disorders, they often have additional qualifications in lymphology. Some general practitioners, interns, or vascular surgeons also have these additional qualifications. It is best to ask specifically before making an appointment. When consulting a specialist, it is important that he knows all the symptoms. When did the swelling start? Is there perhaps a family history? Did the patient previously have venous disease? Has the patient had any injuries, operations, or perhaps radiotherapy in the past? It can be useful to make notes before visiting the specialist. This makes sure nothing is forgotten, and these details help him make the diagnosis. In order to make the diagnosis, the specialist inspects and palpates the affected part of the body. They will then perform a test to detect the so-called stemmer sign. For this, the specialist tries to lift skin from the base of the second toe. If this does not work or the skin fold is thickened because the swelling is so pronounced, stemmer sign is positive. This is an indication of lymphoedema. This test can also be done on the fingers for patients with edema of the arm. Another possibility of diagnosing lymphoedema is to measure the volume, also known as a perometer measurement. This involves measuring the circumferences of the affected part of the body. This is followed by a so-called bioimpedance analysis. Among other things, this estimates body fat and water and delivers exact results. It is possible to carry out the bioimpedance analysis when starting treatment, although it can also be done after decongestion. This enables the results and the corresponding success to be documented during the course of treatment. Once the diagnosis has been made, treatment can begin. Complex physical decongestion therapy is a tried and tested form of treatment, abbreviated as CPD. Treatment of lymphoedema has been divided into phases. In phase 1, the decongestion phase, the volume of fluid is reduced and the limb shape improved. In phase 2, we try to maintain the result that we achieved in phase 1. Both phases consist of manual lymphatic drainage, skin care, compression, and exercise. In phase 1, we implement daily manual lymphatic drainage, followed by skin care and then compression bandaging. We must use bandaging because the edema naturally diminishes from day to day, and a compression garment would consequently slip down completely after 2 weeks at the latest. Therefore, we should apply the compression bandaging for decongestion until the edema no longer decreases. The patients must then perform their exercises in the bandaging. During the maintenance phase, it is possible to make life easier for the patient with medical compression garments. The patients are still given manual lymphatic drainage once or twice a week, depending on how pronounced the edema still is. This is followed by skin care, after which the patients then put on their made-to-measure compression hosiery. That is, compression stocking, toe caps, gloves, sleeve, thoracic compression garments. What a wide range there is for made-to-measure flat-knit garments. That is, we have very special compression garments here, and it is vital that the patients also wear these compression garments when doing their physical exercises. This is the international standard for the treatment of lymphoedema. It is good to include education on healthy eating in the treatment program. Of course, there is no diet that specifically reduces lymphoedema, but the objective is to reduce excess weight and to motivate patients. We want to motivate the patients, the therapists, the specialists, and also the medical supply stores so that they can all work together on this therapy concept. The specialist writes the prescriptions for both the manual lymphatic drainage and for the medical compression garments. Overall, complex physical decongestion therapy achieves very good results, and patients manage to control their edema with this program.